Hello, I am Dr. Kalila Jefferson, DNP. Today, I would like to talk about changing areas of practice in pediatric nursing. Transitioning from the pediatric ICU to the pediatric emergency room sounds, on paper, like a natural move. After all, both spaces care for critically ill children. Both require skill, precision, and compassion. But here's the truth, they are two completely different worlds. In the pediatric ICU, you are trained to think deeply. You know your patients inside and out, every lab trend, every ventilator setting, every subtle change. You anticipate problems hours before they happen. You have time to analyze, time to adjust, time to plan. But then you walk into the pediatric emergency room and everything changes. In the ER, you don't have time to think deeply. You have to think fast. You go from managing one or two highly critical patients to juggling four or five, sometimes more, each at a different stage of illness, each requiring immediate decisions. And here's where the first gap appears: disposition thinking. In the ICU, the patient is already admitted. In the ER, your role is not just to stabilize, it's to decide who can go home, who needs admission, who is critical right now. That level of rapid decision making is a skill that isn't always developed in the ICU. The second gap is breadth over depth. In the ICU, you master complexity. In the ER, you must recognize everything, from minor fevers to life threatening trauma, in a matter of minutes. You don't always get a full history. You don't always get complete information. You learn to trust your instincts, to recognize patterns, to act quickly, even when the picture isn't clear. And then there's the pace. The ICU is intense, but it is controlled. The ER is controlled chaos. There are alarms, families, new patients arriving constantly. You may be in the middle of one emergency when three more walk through the door. You have to shift gears instantly, emotionally, mentally, clinically. And that's not easy because in the ICU, you form relationships. You walk with families through long, difficult journeys. In the ER, you may only have minutes to assess, minutes to intervene, minutes to reassure, and then they're gone. So, how do you bridge this transition? First, give yourself grace. You are not starting over, but you are starting differently. Second, focus on pattern recognition and prioritization. Ask yourself constantly, what is the worst case scenario and have I ruled it out? And third, embrace the discomfort because that discomfort means you are growing. Moving from the pediatric ICU to the ER doesn't make you less skilled. It makes you more adaptable, more agile, more aware. Because now you don't just think deeply, you think quickly. And in emergency care, that can make all the difference. Thank you. Hello, I am Dr. Kalila Jefferson, DNP.